Well, hello everyone, and thank you so much for joining us this evening. My name is Yvonne Covington, and I am the Community Partnership Coordinator for Faith-Based Partnerships and Senior Strategies in the Social Responsibility Office here at Baptist Health. Well, tonight is our second session of our 2022 Community Health Education Series. So this month, our topic is Heart Health in recognition of American Heart Month. Our special guest speaker this evening is Dr. Mona Shaw, and I will be introducing her in just a moment. But first, we usually begin our sessions with a prayer. So I would like to ask my colleague, Mr. Paul Cook, if he would lead us in prayer. Then following the prayer, I will review a couple of housekeeping items. We will have our presentation and our Q&A. And finally, I will end with some brief closing announcements. So Paul, when you're ready, you can begin.
Thank you, Zavonia. Let us bow. Our Father who art in heaven, hallowed be thy name. Bless us as we gather today for this meeting. Guide our hearts and minds so that we will work for the good of our community and help all of your people. Teach us to be generous in our outlook, courageous in the face of difficulty, and wise in our decisions. Bless those who gathered here today. Bless our speaker, who is imparting the knowledge and the health information that is something that we can take and share with our community. Father, we praise you forever and ever. Amen.
Thank you so much, Paul. Thank you so much for that prayer. So there are just a few housekeeping items that I would like to discuss. So first, we are tracking tonight's attendance. So I do realize that because registration was required to attend tonight, that most of your names are already recorded, or we already have most of your names on record. So if there are any groups that are viewing from one Zoom account tonight, I'm asking if you would just list your individual names in the chat in order for us to capture the accurate attendance for tonight. And then secondly, my director, Lynn Sherman, will be monitoring the chat during the presentation. So please feel free to type your questions there and they will be addressed during the Q&A segment. So we would like to now, without further ado, introduce our speaker for the evening. So Mona Shaw, MD, specialized in cardiology due to her love of analyzing and detail-oriented care. In order to further develop her passion for treating the whole patient and educating them on the connection between their lifestyle and heart health, she became board certified in holistic medicine. Dr. Shaw's areas of expertise include holistic medicine, women's heart health, valve disease, heart disease prevention, and non-invasive cardiac testing. In addition to cardiology, Dr. Shaw became board certified in integrative holistic medicine because she has seen the result of treating not only a patient's physical symptoms, but also working with them to make changes in their nutrition, stress level, and medications to improve their heart health. She also understands a patient's desire to use more natural vitamins and supplements in addition to traditional medications. Dr. Shaw strives to really hear her patients and help them find the root of their health issues in order to best heal their heart. So Dr. Shaw, if you want to go ahead and start to prepare your screen.
Yeah, sure.
And while she is, I'm going to stop sharing mine. While she is preparing, I wanted to just mention again, for those of you all who are just joining us, if you're viewing our tonight's session through Zoom on one account, just ask that you please just list your individual names in the chat just so we can make sure we have accurate attendance for tonight. So Dr. Shaw?
Yeah, can you hear me?
Yes, hear you great.
Okay, wonderful. Thank you. Thank you for that great welcoming, and thank you for all of those who are out there in the Zoom world with us. We appreciate it. And so my favorite topic to talk about. So that's good for all of us together. So we're gonna just start diving right in. As Ivania already said, I do both. I do traditional cardiology as well as holistic cardiology. And most of my patients want that combined approach. And Just like Zavanya kind of introduced me as, I started noticing that a lot of patients, once I started practicing cardiology, needed a little bit more than here's a medication, here's a test. I don't know what else is causing your symptoms, and then move on maybe to the next doctor. So I felt unsatisfied giving my patients that sort of diagnosis, and patients left, well, why am I having chest pain? So I started seeing a lot more how lifestyle was really important in how we treat patients and how patients present. We're barely taught anything about lifestyle in medical school. We're maybe given a lecture at the most about diet and vitamins and stress. I think that's touched upon in 4 years and maybe in all of an hour. So that's why I decided to get board certified in integrative holistic medicine, just so I could really understand the depths of how all those three, stress, lack of certain vitamins and supplements, as well as most importantly, nutrition, can tie into the underlying root cause of why someone has high blood pressure, why someone's cholesterol is out of control, why they're having chest pain, etc. So that's why, to make a long story short, why I got board certified in both. So this talk is actually going to try to combine both areas of cardiology: traditional, what you all need to know, the root of what is a heart attack and how it's caused, the basic risk factors, and then what we can do on the holistic side to kind of help decrease that risk. So this is cardiology kind of 101. So I'm going to actually figure out how to do this today. So here's a laser pointer I found that we could do on PowerPoint. So this is the heart muscle. Okay, it doesn't look like this. It looks like this. This is what a heart muscle looks like. And the heart arteries, you can see with my laser pointer. Hopefully you guys can see the laser pointer as well. The heart arteries are on the outside of the heart muscle. The heart is a muscle, basically. So and then this is a close-up of one of those arteries, and you can see all this plaque buildup, cholesterol, cells, and you can see that the blood flow obviously can't go, okay? And then this muscle dies because there's no blood flow going to it. And that's what a heart attack is. That's a basic of what a heart attack is. You have a blocked artery that's enough where there's not enough blood flow going to that muscle, and then the muscle dies. That's what a heart attack is. So our job as cardiologists is, how do we prevent all of this from causing a heart attack? So we know that starting from our first decade of life, we're already, and looking into our 30s, we're already getting a little bit of plaque buildup. So it starts at a very young age. And we don't, how many of us, when we're 10 or 20 are even thinking about our heart arteries? We think we're immortal. We're eating what we want. Maybe we're exercising, maybe we're not. We're probably doing things that are not best for our lifestyle, maybe a lot of stress. But that's really where it starts. So if I can get someone in their 30s or 40s even, we can try even at that age to say, hey, let's try to slow this down. But it doesn't mean it's too late. Even if you're in your 60s or 70s or 80s, there's always time to prevent this from causing a heart attack. And what we know as well is, see this white cap that's kind of on top of all this plaque buildup? That's a very strong, thick covering. And we can live with a blockage of 30%, 40%, 50%, something like in this range here. We can live with that for the rest of our life, and we may never even know that we had blockages, as long as two things happen. One, it doesn't progressively grow. Even as the cap is still there, if it progressively grows, we say as cardiologists, sometimes those are our easiest patients, because they've got an 80% blockage and it's stable meaning that cap is still intact, but there's just too much stuff in the pipe. We know that they're going to say, well, I used to walk a few blocks and have no problems, and now I can only walk a couple blocks and I start having chest pain. Most of the time we know that's probably a stable plaque that's just gotten too big, that either needs to be treated with medicines, lifestyle, and or a stent. We normally don't stent arteries or put stents in arteries to open them up unless they're 60, 70% or more. And a heart attack is usually 99% or 100%. So that's one group of patients. Like I said, those are sometimes a little bit easier to figure out. The second group, which are the harder ones, are people who we all know, they just ran a marathon, they're super healthy, they exercise, they just passed a stress test, and then they had a heart attack a week later. What's happening there? What's happening is that, let's say they have this 20%, 30% blockage. If that white cap covering tears open all in a second, right? All of the stuff inside, the plaque, cholesterol, the cells, all the junk is what we try to call it, comes to 100% within a second. So that 20% now all of a sudden is 100%, and that's that massive heart attack. Well, we're not going around putting stents in everyone who's got a 10 or 20% blockage. That doesn't make sense. So what are we going to do? How do we protect this white cap from keeping all that cholesterol and the cells and the inflammation? How do we keep it all there? How do we prevent it from tearing? That's where all these risk factors that I'm going to talk about come in. Controlling those risk factors, lowering inflammation, blood pressure, diabetes, not smoking. And then that's where some of the lifestyle comes in. Stress can tear that covering as well. So that's what we're going to dive into. But I really wanted you to understand what heart disease is from the core and what a heart attack is. So we know that heart attack and cardiovascular disease is still the leading cause of death for men and women. Someone has a heart attack every 4 seconds in the United States. And 20% of heart attacks are silent. So sometimes, most of the time it's in diabetics, but sometimes we'll get patients who come in with an abnormal EKG and we'll say, oh, so when did you have your heart attack? And they have no idea. They were just maybe a little bit more tired, but didn't really know that they had had a heart attack. Doesn't happen that often, 1 in 5, but most of the times they are diabetic, especially diabetic women. And we know out of all these statistics, what's most important is that 80% of strokes and heart attacks are actually preventable. I mean, that's a huge number. And to dive in for women, because this is, Heart Health Month, and we always try to make sure that we include our women because they're so important, and trying to educate women in heart disease as well, that 1 in 4 women will die of heart disease compared to 1 in 30 for breast cancer. Now, we're making a lot of progress educating women about this. Back when I used to give this talk 15 years ago, a lot of women still thought they were going to die of breast cancer, not of heart disease. But I think that all these kind of talks that we're doing in education, women now realize are much less likely to die of breast cancer compared to a heart attack. And the other thing that we know is that under the age of 50, if a woman has a heart attack, she's twice as likely to die of them. Why is that? I mean, why are women having less heart attacks than men, but they're dying more of them? And it's because, and we're getting better at this, but when there's been enough statistics to show us that when a woman comes into an ER, she's slower to get an EKG, she's slower to get the blood work, she's slower to get the catheterization lab. We're getting better by education and ER doctors and internal medicine and even cardiologists. We're all getting better with education, and women present differently a lot of times, which we're going to get to the symptoms in a second. But we have to really know this, that, okay, just because I'm a woman and I have this symptom, I really need to get checked out, because only 30% of women actually have chest pain as their symptom. The classic symptom that we hear about is the elephants on the chest, and it feels like a tight band around the chest. That's the classic symptom that we teach for a heart attack. But only 30% of women have that. A lot of women have shortness of breath, that they're just more short of breath. Women have fatigue. And this is men too, okay? I'm not just talking about women. Men and women can have other symptoms besides just chest heaviness for their symptom. Shortness of breath is a big one. Fatigue is another one. Abdominal pain, a lot of times you think, oh, I'm just having a bellyache. And then it ends up being a heart attack. Nausea, throwing up, sweating. And, a lot of us are probably tired. We're probably getting somewhat short of breath. Maybe we have some belly pain. I mean, how are we going to differentiate if this is a heart attack or this is just, I had a long day, or I'm getting, older. I get a lot of, well, I am getting older. And I said, well, maybe, but let's dig in a little bit more. And what I always say, my one statement I always say is, your body way better than I'm going to know in a 15-minute or 30-minute meeting with you. So if you tell me that, 6 months ago, I was able to go hiking or even ride my bike or swim a few laps, and I've noticed for the past few months, I'm just a little bit more tired doing that. I'm having to gasp for air a little bit more. That's something new. So if there's something new, 6 months, a year, that's when the flag should go up. This is not normal for me. Now, could it be other things going on, like high blood pressure, or you're just getting older, or something else in your life happening? Of course it could be. But those are the times when I say, really listen to your body. Now, if you've been having shortness of breath for 10 years doing something, it's probably not an acute heart attack, okay? Probably haven't been having a heart attack for 10 years. Or if you've been tired for 10 years and it hasn't gotten any better, you do need to get checked out, make sure there's nothing going on, but you probably haven't been having a heart attack for 10 years in a row. So what I always say again is if there's something new for you, I have people who can run and work out a lot. So for them, a little change to a normal person, seems like, well, this is what's a big deal. Instead of running 5 miles, or run 4.5. Yeah, but that's a change for you. And that's what you want to pay attention to. So what can't we change? So we cannot change our ethnicity. So we know that African Americans and Hispanic Americans actually have even a higher risk than Caucasians for heart disease. Age, unfortunately, no one's come up with a real anti-aging way. So we know as age goes up, heart attack and cardiovascular risk goes up. And then family history. Family history is a little bit tricky. If you get a gene from one of your family members, usually when we talk about family history, it's direct family, mom, dad, sometimes uncles and aunts, but most of the time the direct family, siblings, of course. And they had a problem at a young age. If your parent had a heart attack in their late 80s or 90s, that's really technically not considered a family history, because they kind of were already at an age where they were high risk. Now, if you inherit the gene, let's say everyone in your father's side has had some problem with their heart in their 40s and 50s. If you have this lifestyle, you'll probably follow suit. On the flip side, if you decided, I want to make sure this gene, I'm going to do my best that this gene doesn't get turned on in me, and do different types of lifestyle, you may not have it necessarily show up in your life. So again, the take-home point of that is, just because it's in your family doesn't mean you necessarily are going to have to deal with that too, if you can do something different that maybe your ancestors did not. So this is a busy slide, but this is an extremely important slide. So what are the things that we can work on? What are the things that we can change? Okay, so smoking obviously, is on this list. So we know that just regular cigarettes can increase your risk of heart attack and cardiovascular disease 2 to 4 times from your baseline. And even e-cigarettes can double the risk, sometimes even higher, 5 times the risk. So no type of smoking is good, whether it's an e-cig or vaping or traditional cigarette, okay? Exercise. So by itself, forget about the fact that if you don't exercise, you're at higher risk for diabetes and high blood pressure and obesity. Take that on the side. Just not exercising by itself is the cause of heart attacks. It can be a significant cause of heart attacks and heart disease. And we know that only 1 in 5 people are really exercising 30 minutes, 5 days a week. So this to me is kind of a no-brainer, in the sense of, if you exercise just 30 minutes a day, you're going to cut down your heart disease risk by 30-40%. There's really no drugs that do that out there. There's nothing that does that out there. So, and that's free for the most part. If you go for a walk outside, or maybe you join a gym, it's going to be a little bit of money, but for the amount you get for what you're putting in is huge. When we talk about, bang for your buck or whatever, that's what we mean, exercise. And I say, listen, you can find 30 minutes to give me. And if you can't find 30 minutes altogether, I'll take 10, 10, and 10. I do 10 minutes in the morning, do 10 minutes at lunchtime, and do 10 minutes in the evening. It's all additive. I'll take that even, but please try to find 30 minutes at least 5 days a week. Start with just walking. If you even just go for a simple walk, just walking outside by itself, getting some sunshine, getting some vitamin D, being in nature. And then on top of that, you're helping your heart. If you want to step it up, do some more cardiovascular, do some resistance training a couple times a week, throw in some yoga for the stress benefit, but if that's all too overwhelming, then just start basic. Go for a walk for 30 minutes. If you have knee issues and you really don't want to push the walking, do a recumbent bike. Go for a swim. Swimming is great for preventing the joint issues from getting worse. So we have a lot of different options. And I think what we've learned with COVID is, wait a minute, we don't have to go to a gym. We can actually download things at home. YouTube is free. We can download workouts on YouTube. So really, I want you to think about and find a buddy if you need to. Sometimes it's easier if you have a walking partner or an exercise partner. Do whatever you need to get that exercise in. What about high blood pressure? Know your numbers. I can't tell you how many times we'll see patients, they have their blood pressure is high in the office. They don't really check it at home. They don't really know what it is at home. I really encourage most people to have a blood pressure cuff at home. For $50, you can get a pretty good blood pressure cuff. You want one that goes around the arm, preferably not the wrist, because closer to your heart is better. And check it, maybe once every few weeks, because if you're going to the doctor just once a year or twice a year, and that's the only blood pressure check you're getting, high blood pressure can be silent. You might not even know you have high blood pressure until we're kind of on the other end of the spectrum. So that's something to me is, keep an eye. And plus, a lot of times when people come into the doctor's office, the white coat, being in the doctor's office, especially a cardiologist, their blood pressure skyrockets. So I always say, just check it at home. Let me see what your numbers are at home. If you're good, then, we won't need to do any medications or anything. But if they're running high at home, that's telling me that we need to do something about this a little bit more aggressively, whether it's diet, lifestyle, a little bit of medication or a vitamin or supplement. Diabetes also, increases heart disease risk in men and in women, but more so in women. So know what your hemoglobin A1C is. Try to work with primary care, work with your cardiologist for nutrition, see what you lose weight. Diabetes, the best way to lower your diabetes is losing weight and controlling your diet. That's the best way, especially for type 2s. I'm not talking about type 1 diabetics. I'm talking about the type 2s. And then cholesterol, of course. Know your numbers. What is your good cholesterol? That's the HDL. What is your bad cholesterol? That's the LDL. Do we need to do a calcium score? A calcium score, we do them at Baptist Radiology, all of the Baptists, and their CAT scans takes about 5 minutes. There's no dye, little bit of radiation, and it spits out a number of how much plaque buildup do you have. If you've already had a heart attack and stent, it's useless to get a calcium score, but I'm talking about you have a little bit of risk factors, a little bit of high cholesterol. Do I already have blockage building up? Because remember, stress tests, when we have a stress test, it will really only pull out if you've got a blockage that's significant, 70% or more. So that's good if you pass a stress test. That's wonderful, but it doesn't show me, well, do you have any plaque buildup? Do you have a little bit already sitting in there that just hasn't reared its ugly head yet? That's what a calcium score can be beneficial for. What about being overweight or being obese? So 2/3 of Americans are either overweight or obese. It's the highest it's been in history, and it's just going up higher, even in the pediatric age. So by itself, we know that obesity causes diabetes, high blood pressure, high cholesterol. It can, definitely be a risk factor for all those. But by itself, just being obese or overweight increases your heart attack risk by 2.5 times. So again, and here's the thing, some people, it's so daunting. I gotta lose 50 pounds. How am I ever gonna do it? Just start from slowly, 5 pounds. Think about that. Just losing 5 pounds can have some benefit. So the lower the risk, the better, right? So anything we can do to lower that risk, even losing 5 pounds. And like I said, find what works for you. It's Jenny Craig or Weight Watchers or having a buddy or finding a nutritionist, see a lot of patients I know already know what they need to do. They just need someone to hold them accountable. They need someone to help them figure out what kind of exercise, what kind of diet should they be eating. And we're going to be getting into that. So, try your best to, if you need to lose weight, start with a small amount and go slowly. I always say when people are losing weight, a pound a week, maybe 2. But that's it. If you're doing these crazy diets, lost 10 pounds in 2 weeks, I don't know what you're doing. Doesn't sound good, doesn't sound healthy. And I'll tell you this much, it's probably not sustainable and you'll probably gain it all back when I see you in a year. So really remember, the slower the weight loss, the more sustainable. All right, what about food? So I personally do not believe in the word diet. When I say diet, I really mean food choices and lifestyle. I have not seen anybody, and I've been doing this for a long time, tell me that they've tried this diet, whether it's Atkins or keto or I don't even know, there's a million of them, right? Paleo, whatever, any of those. I haven't seen anyone, shouldn't say anyone because you never can say anyone, but I've seen probably very few people can count on my hand that can actually sustain it through years of their life and it's become a lifestyle. So I'd rather people find a way of living that you can actually sustain and do it most of the time, 80% of the time. 20%, no one's going to be perfect all the time. You need that wiggle room a little bit so that you can, that 80%, which is so important, you can do what you need to do. And we know that Mediterranean lifestyle has been studied over and over and over again. And it has the best track record for lowering cardiovascular risk. When we look at fats and carbs and proteins, what is that? So fats, what kind of fats are you going to do? Olive oil, avocados, avocado oil. You want more of the monounsaturated fats, chia seeds, flax seeds, nuts, not necessarily peanuts, but almonds, walnuts, pistachios. I'm not anti-saturated fats. I think having some saturated fats is very important. Pure butter, preferably grass-fed, full fat yogurt, those are but again, it's all additive. So if you're eating, this is why I'm not a fan of keto for the 99% of people, is because 1, it's usually not sustainable. And 2, when I see someone's labs, before I even walk in, you're doing keto, aren't you? Because I can see the inflammation markers go up, the cholesterol skyrockets, and the fats that they're eating for keto are, what is that? The bulletproof coffee and coconut oil and butter and cheese and yogurt and, lard and bacon and all kinds of saturated fats, which yes, you need some, but you don't need this much saturated fats. So and the only time I really am like, okay, if you really want to try keto for a little bit is if someone's really having a hard time lowering their sugars and their carbs, then I'll say, okay, try keto for maybe a week or 2, but it's not something you're going to just stay on keto forever. If you need that to help your brain kind of stop being addicted to sugars and carbs, maybe for short term, but then you want to start incorporating, because there's something to be said about grains and whole grains. And we know that whole grains can actually lower cardiovascular risk. The problem with carbs and why carbs have gotten such a bad name is that people just eat way too much. So, if you're having a bagel for breakfast, a sandwich for lunch, a bunch of rice or pasta for dinner, that's just going to be way too much. 1 portion of a whole grain is 1 slice of bread. 1 portion of brown rice or grain like quinoa or any of those is 1/3 of a cup. So, oatmeal, 1/2 cup of oatmeal, 1/3 cup of oatmeal cooked. So it's not that you can't eat carbs. It's just, it's probably this part of your plate compared to, have some, but don't overdo it. I know personally, to me, if someone said don't have carbs or grains, I think I would just walk away from them, because I like my whole grain bread. I like my quinoa, but I measure it out and make sure, okay, I'm not overdoing that. Sweet potatoes, another great complex carbohydrate. It's just things with all the added sugar, all the white stuff, the things with the processed, you've got like 20 ingredients. If you turn it around and it's got 30 ingredients and you don't know majority of them, it's probably not going to be good for you. It's probably should go in that 20% part of your lifestyle. You know, you want to have as whole unprocessed foods as possible, or maybe 3 to 5 ingredients, but you don't want something with 20 to 30 ingredients. And then when you look at proteins, you know, really Mediterranean with fish, pescatarian, if you want to call it, with some plant-based, that's really the best way. So if you can focus more on fish, some chicken, and really try to especially stay away from the processed meats, hot dogs and bologna and hams and deli meats are loaded with things to raise your blood pressure and sodium and nitrates, and you know, some chickens are even loaded with antibiotics and hormones. So you want to be careful where that animal source is coming from. And even fish is great, but if you're eating a bunch of farm fish that's fake colored pink and it's got antibiotics in it, it's probably not the best. You know, wild fish is going to be better. Eggs are okay. I usually tell my patients, I don't shy away from eggs, but if you're doing 3 or 4 a day, you probably don't need that much. Maybe stick to 1, 1.5, have an egg and an egg white every day if you want. And then the other thing is really, you know, keeping the added sugars low. I mean, if you look at yogurt, you know, I know this example is given, but if you turn a yogurt around and lactose, which is dairy, right? That is going to have natural sugars. That's a natural sugar, like a fruit. That's very different than what I'm talking about, added sugars. So if your yogurt should have, you know, per serving, maybe 7 grams of lactose sugar, that's natural. If it says 25 or higher, all of that is added. They've just added whatever, fake blueberries or raspberries or sugar itself in there. So you're just adding extra sugars in there. Instead, if you want yogurt, buy plain full fat Greek yogurt, tastes amazing. And if you want to sweeten it, stevia and monk fruit are probably your best bets because they're more natural compared to Splenda and Equal and some of those other ones. Put some blueberries, put some nuts. You've basically eaten, that's a whole food. Yogurt, that's the ingredient. Blueberries, nuts, you know, and then you add a little stevia if you even need that. So pay attention to how much sugar is in things, especially how much added sugar is in it. And alcohol is going to be in moderation. So maybe a glass, a proper glass, 4 ounces, 5 ounces of wine is 1 glass. Hard liquor is 1.5 ounces. So, you know, kind of pay attention to how much you're drinking, because all of that, again, is additive. The more you drink, it's worse for you. What about, just checking the time here real quick, making sure I'm good. Okay, so what about vitamins and supplements? So, you know, there's every individual, to me, I'm not a fan of multivitamins. I'll start with that, because in general, I feel like multivitamins kind of give you a little bit of this, a little bit of that, but are you really getting what you need for your body? And my approach is really about every individual person's different. This person may need vitamin D, but this person may not. So I'm not going to give you a generic, take this vitamin, take this, just like I don't like to do that with medications. So omega-3s, maybe you need some, maybe you don't. Omega-3s we know are beneficial for the heart, but maybe you're eating enough fish. Maybe you're getting enough omega-3s from other sources. What about vitamin D? Vitamin D is a fat soluble vitamin. So if you're just popping vitamin D and have no clue what your levels are, you could be doing more damage than benefit. It's easy to get a vitamin D level checked. You might get your vitamin D level checked and you're good. You're in a good range. You're getting enough sun and it's getting absorbed in your body. You might not need any, but always get that level checked before you just get on some dose. We know that low vitamin D is linked to heart disease, heart failure, cancers, higher amounts of inflammation. We know this with COVID now, that low vitamin D is linked to higher risk of having worse corona infections. So it is one important one to get your levels checked and then either get more sun, which is the best way, or supplement with the vitamin D. I always tell people to avoid calcium as much as possible in pill form, because for some reason, calcium in a supplement form ends up a lot of times going to the heart where we don't want it to go, and instead of going to the bone. So I usually tell people, if you have to take calcium because your endocrinologist says, listen, your bones are terrible, you need some calcium. If you really don't think you can get it in your diet, then make sure you're at least taking vitamin D with that calcium so that it goes to the bones. And that's where that K2 comes in. So that K2 is what helps keep calcium away from the heart, and it shuttles it to the bones. Garlic is another great herb and vitamin, but supplement, I should say. Eat garlic. Age, the older the garlic is, the better it is. So don't throw it away unless it's moldy. There's just more antioxidants in older garlic. CoQ10 is a coenzyme. So CoQ10 is a coenzyme used in every cellular function. When you're older, if you're diabetic, or if you're on certain cholesterol medications like statins, your body just can't make enough. Another reason to supplement with CoQ10. And then magnesium is probably my favorite mineral. It's a calmer. Think of it as a calmer. So I tell people to take it at bedtime, helps them sleep. I use it a lot of times when people have palpitations, like fluttering, and they're having a few extra beats, not necessarily AFib, but I'm talking about just regular random skipping. Palpitation, magnesium half the time does a trick, and I don't ever have to use a medication. It's good for migraines. It helps you sleep. It's good for lowering blood pressure. So magnesium is one of my favorite ones. Now, there's about 20 different types of magnesium. So, I have a whole different talk on vitamins and supplements and what kinds to use. And I have a blog also that I'll show at the end. That I've actually done. Everything I'm telling you today is kind of summarizing. I actually have specific blogs on each of these, on vitamin D3, on K2, on CoQ10, on magnesium, on the diet, on fats, on protein. Just so this is kind of, I'm just sprinkling everything into this talk just so we start opening up our minds and understanding what we can do for our heart health. So we know that stress is equivalent risk factor for heart disease, just like high blood pressure is. And we don't really address it that much, because by the time we're in the office and doing the meds, hey, are you stressed out? Yeah, okay, well, go find a therapist or something. So we really need to, and that's another, when I do my holistic visits, I really want to I'm not a therapist, but I really want to see, what can I help you with? What can I make you understand what stress does to our body? We know that that fight or flight response, that is the amygdala. The amygdala is a little tiny almond shaped in our back of our brain. It's an organ, and it secretes those fight or flight, the adrenaline, but it's really only designed to do that when there's a major life-threatening thing happening. Someone's breaking into my house right now while I'm giving this talk. I'm not going to kind of sit and contemplate, what should I do? I'm going to run for my life. I don't need to sit and meditate on that. But what happens is our amygdala over time kind of gets dumb, as I like to call it. So it can't tell if somebody's, I don't know, let's give an example. Let's say you're at the grocery store and you're ready for going somewhere, and the person in front of you basically you're in the express line, the person in front of you has 50 things, and they forget their wallet, it's a whole thing, and you're like, oh my gosh, why did I pick this line? Well, your amygdala is like, okay, here we go, time, I feel the emotion, I need to start secreting adrenaline and cortisol and all these things. And what do? Adrenaline, we know, actually makes platelets stickier. You remember that initial slide in the beginning that showed that artery and the heart attack? Those were platelets that were clumped up on top. We know that adrenaline increases the arteries, makes you more constricted. We know that because our face, when you're frustrated, your face gets red and flushed. It can cause gastric acid to increase. That's why people get belly pain sometimes when they're stressed out. We've even seen it down to the DNA level, where DNA actually gets shorter and aging gets worsened more progressively. Cortisol makes us heavy around our middle. Our immune system doesn't work as well. Inflammation marker, we see it all the time, goes up with stress. So that's what stress, when you have, I'm not talking about big stressors, losing a spouse, losing a child, that's a different ballgame. That can cause actually broken heart syndrome. That's a different thing. I'm talking about the day-to-day, this person upset me, I talked to this person on the phone and they made me mad. I was at the parking lot and someone took my spot. It's that day-to-day stuff, the anxiety, the stress, depression. That's when we get these levels of adrenaline and cortisol streaming through our system. And years of that will catch up with all the effects that I just mentioned. And it's not about getting rid of the stress. It's very hard to just get rid of things. Sometimes if you find that, okay, I have this one stressor, I've got a lot of other stressors, but this one stressor is really, causing me a lot of issues, and you feel like that's something that needs to change, then do it. Most of the time, from what I see, it's just stuff around us. I mean, if anything we've learned from COVID is we can't really control much of anything. And so if you think about that most things that happen to us, we really have no control over. The only thing we can really control is our response to it. How are we going to react to it? Are we going to go, A to Z, or are we going to maybe get a little upset and then just take some deep breaths and realize that, well, there's probably not much I can do. Let me change my perspective about it. Because when we feel good, when we meditate, when we do breathing exercises, when we're with friends, when we're kind to others, when we're hugging somebody else, when we're doing a hobby that we really enjoy, that's when all those happy hormones get released, serotonin and oxytocin, and they do the exact opposite. Our arteries dilate out, our DNA actually becomes more anti-aging, our platelets are less sticky, immune system works better, inflammation comes down. It does a lot, the relaxation response. And most people are out of balance is what's happening. So their stress response is here and their relaxation response is all the way down here. So how do we maybe bring the stress down response a little bit and raise the relaxation response? Let's try to be just more balanced. Meditation, again, another free thing. And I say, just start with 5 minutes. It doesn't have to be a whole woo-woo thing. Just take some deep breaths in through your nose. You can count up to 4, hold it for a second and breathe out. You can have a mantra like breathe in and say, I am, breathe out and say at peace. Just keep it simple. Just do it for 5 minutes. Just 5 minutes of that will start already releasing all those relaxation hormones. Find a hobby. Again, back to exercise. We know that exercise is sometimes almost equivalent to taking an antidepressant. So again, it's free. Just get out there, get some sunshine in there, write in a gratitude journal, write 3 things you're grateful for right when you wake up in the morning. How many times do we wake up in the morning and we're just already, our brain's kind of going about everything that's going to happen that day? What if we just 10 minutes in the morning before we just jump out of bed, we have a journal next to our bedside and we write 3 things that we're grateful for. They don't have to be big, massive things. They can be little things. And then we do some breathing exercises and then we start our day. Just 10 minutes of doing that will definitely change the way your day goes. And I love this quote because I feel like in this world right now, there's so much anger and frustration and depression. And they've done studies, I'm always about studies, but we know this because we're humans. And despite the studies, that just showing a little bit of love and compassion and kindness, they've done studies where if I smile at a stranger, I'm already releasing for myself those happy hormones and for that other person. How nice is that? Just a smile. It doesn't even have to be anything big. So just remember that when we're out, give a smile, pay it forward, let someone come in front of you if they're trying to merge. Just those little things can make big differences. This is my blog address. There's, like I said, tons of information on there about everything we talked about. If you type your email in there, then any article I'll probably post this video as well once it becomes so anyone can watch it again. I've done articles for Baptists before. I've done different articles. I've done other Facebook Lives for Baptists. I've done my own different articles on vitamins and stress. So if you click on follow and type your email in, it'll automatically come in your inbox. And if you're on Instagram, which I barely am, there I do have some heart holistic healthy stuff on my Instagram page. And that's it.
Thank you so very
Yes,
much.
that was awesome.
Thank you so very much, Dr. Shaw. We really
You're
do
welcome.
appreciate this. Dr. Shaw, you gave us some very informative information. This session was really, really informative, and we really do appreciate this lesson that we've gotten today. You spoke to some of our good habits, some of our bad habits, and you told us what we needed to do about our bad habits, and that we appreciate tonight. I really learned a lot myself from what you shared with us tonight, and we'll certainly be excited about sharing it with others in my life for sure. We have a few questions from the audience that that I'd like to pose to you right now, Dr. Shaw.
Okay. Yeah.
First, we have a question from Ed. He wants to know, does Dr. Shaw do diagnostics on people in their 20s or 30s? If so, how often do you do that?
It's a great question. So I'm assuming when you mean diagnostics, like stress tests and calcium scores and or an echo and ultrasound, I'll assume that's what that means. It depends. So usually a calcium score, the one that I talked about in your 20s, is not as helpful because, you know, calcium scores are going to show us the hard plaque buildup. A lot of times when you're younger, you have soft plaque buildup. That being said, if someone's in their late 20s or early 30s, it's a very strong family history, has very high cholesterol. If their calcium score is not 0, I mean, at that point, you should have a 0 calcium score if you're 20s and 30s. If you have even a little bit of plaque buildup, that to me is a red flag. Like you already have hard plaque. That means you probably have soft, mushy plaque. So that's one thing. Secondly, it depends on a stress test or an echocardiogram. If I see that if you come in saying, hey, I'm having a little bit of symptoms, I don't feel as good, I just want to get checked out, my EKG is a little bit different, then I probably will put you on the treadmill and push you. But remember, stress test will only pull out if you've got severe enough blockage. It's not going to pull out if you have a little bit of blockage. And then echocardiograms, obviously we use to look at for heart function, valves, if were you born with anything that's going on. So we use that for different things.
Okay, thank you very much. Speaking of calcium, there is another question that has to do with calcium, but primarily around age. And they wanted to know, do you recommend getting the calcium test for people around in their 60s with hypertension, or any other test to check their heart?
Yeah, so calcium scores, like I said, are wonderful because I usually won't order it. Like I said, the 20s, it'll be very rare if I order it for a 20-year-old. I'll usually start ordering it maybe in the mid 30s in the right circumstance, definitely in the 40s, 50s, 60s for sure, even 70s, we'll get a calcium score. Like, again, if you've already had a heart attack or stent, or you know for some reason you had to have an angiogram when we already know you have some certain amount of blockage, it's not as useful. But if you're someone who's 60, 65, has high blood pressure, and you just want to, and maybe a little cholesterol or maybe not, and you just want to know, do I have any hard plaque or not? Calcium score is a way to go.
Very good, thank you. This question has to do with this beautiful slide that you had with cholesterol on calcium deposits in the vessel. And the question is, at what point are fatty deposits removable, or are they permanent once they form?
That's a great question. So we get that asked a lot. You know, let's say we do an angiogram on somebody, right? For whatever reason, they end up going all the way and having a catheterization. And let's say they were actually didn't need anything. They didn't need a stent. Remember, stents we normally do for 60, 70% or more, or bypass, you know. Let's say they had 20, 30% blockage, right? Okay, now what? Can I get rid of that? Or is this going to be with me forever? Two things. One, people can live with a 20, 30% blockage their whole life and not even know it, or not have any symptoms from it. So obviously, number one, we want it to prevent it from growing to 20 to 30 to 50 to 70 to 80, right? The second thing is, like we mentioned, we also don't want that cap to rupture. So as far as reversing it, very rarely have I seen someone's blockage completely disappear. Obviously, unless they're getting a stent or something like that. And then that just kind of pushes everything open. Once I have seen a few people who've completely changed their lifestyle around, maybe they're more vegetarian, less animal proteins, exercise or on certain supplements. I've seen them maybe go from a 30, 40% down to a 10 or 20%, but that's not normally the case. Normally we see it just kind of stay there and maybe get a little bit better. Because remember, our goal is not to have, for you to have 0%. You know, even if you have, again, 10%, which doesn't seem like a lot, that still can rupture and cause that heart attack. So we just want to keep all of that 10 or 20 or 30% underneath that protective cap. Does that make sense?
Yes, very good.
Yeah.
Very good sense. Thank you. So I do have another question from one of our guests. What do you think of the formula that supposedly predicts the likelihood of a major cardiac occurrence within the next 10 years? Is it reliable, or do you think it's a hoax to sell drugs?
Are you talking about the Framingham risk score? Is that, I'm assuming, is that what that is? The Framingham
They weren't specific
Okay.
about what the name of the formula, just the formula. So I assume that you probably were familiar.
I'm assuming that's what that is, because that's the most used. Yeah, I think, and that is the most used risk calculator score. There are some newer ones that I actually like that add the calcium score with it, because, you know, being a holistic cardiologist, one of the biggest types of patients I get is they have high cholesterol. Their general doctor or their cardiologist says, here's your statin, right? They don't want to be in a statin, so then they come to me. So then we kind of have to figure out, okay, now what do we do? And again, every person's different. I don't like that knee-jerk approach personally. I'll do a couple other things. Maybe I'll do the risk calculator. I'll definitely get a calcium score. And the other thing I like to do, actually, which I think is very helpful, is get an advanced lipid panel. The advanced lipid panel, which is just blood work. Quest does a really good job of LabCorp has one kind of panel, but Quest, I like their labs a little bit more, what they give you. But it looks at the LDL closer, which is what I want to do, because LDL, remember, is a bad cholesterol. I can have two people who have maybe an LDL of 150, okay, which is a little bit high. Because normally we want people lower than 100, 130 at the most, maybe lower. And if you've got other stuff, we want it even lower. But what if these two people who have 140, 150, who are now told to be on statin, what if this person's eating like Arby's and McDonald's and, you know, smoking and whatever, and then this person's actually eating a really, really good, healthy lifestyle diet? You think their LDL looks the same? It probably doesn't. This person's LDL is probably sticky. It's probably inflamed looking. It's probably small and ugly looking. And this person's LDL is probably better looking, less inflamed. And so what I'll do is I'll get that advanced lipid panel and the calcium score, and we discuss it. Say, listen, your calcium score is 0. You have no hard plaque buildup. Your LDL's number is high, but it's not ugly. It's not inflamed. Not going to necessarily go by that risk calculator score. I'm going to go by what you look like. Does it mean that it's going to stay like that for the next 10 years? I don't know. We'll check you again in next year or in the next couple of years and go through this again and say, okay, because it's always changing. On the other hand, if you have an LDL that's high and your calcium score is high and it's inflamed and it's sticky, I don't know what that calculator may say or may not say, but I'm telling you what, you're probably going to have a much higher risk of heart disease because your particles are way stickier and you've already got plaque buildup. So I know that's a long answer to the question, but I don't like to just use a risk calculator and base everything on that. It's a lot more comprehensive for me.
Well, thank you for that answer. It may have been long, but it was thorough enough that I believe our guest understood what you meant and really understands that you look at one patient at a time, and there's no way to you choose not to cookie cut them. So
Yeah.
I have another question from our audience. It has to do with exercise, primarily weightlifting. Is weightlifting medium to heavy weights okay for the 30 minutes of exercise, or do I really need to do cardio too?
Great question. I love weightlifting. I think resistance training is so important, especially as we get older, whether we're a man or a woman, especially for women, even more so because our muscle mass, once our estrogen goes down, goes in the pit. So So yes, I think weightlifting is great. And a lot of times if you're getting your heart rate, if you have, like I lift weights 4 days a week, and I do a little bit of cardio, but I have a Fitbit, and my heart rate is in that higher zone when I'm weightlifting. So if you're getting that there, I don't care. That's perfect for me. You don't need to do anything. I think sometimes just doing a walk in between is just more, that's what I do, just more for my mental health, or I'll go on the treadmill and, go on an incline just to kind of get a little bit more of that. But yeah, I think if you're doing weightlifting and you're keeping your heart rate in that percentage where it's higher, which is, what is that heart rate? You obviously don't want to be 100% of maximum predicted heart rate, but you want to be, 60 to 70%. You want to be able to, if you're having an easy conversation, can sing a song, probably not working out that hard. But if you can't even utter a word, that's probably too much. Unless you're doing interval training, then obviously, you want to have that back and forth. So I'm good with weight training if you can keep your heart rate up.
Sounds good. Sounds good. So we have one more question
Okay.
for you before Zavanya comes in and does our closing.
Okay.
Is a carotid ultrasound a good indicator for predicting heart attacks?
Yeah, so carotid ultrasounds are kind of gone in the same category as the calcium scores, because if you've got, so it's the same thing in the sense of if you've got a little bit of plaque buildup here, you're probably going to, arteries are arteries, whether it's carotids or heart or legs. So I traditionally don't, and most of us cardiologists have kind of stopped ordering carotids as much unless we hear something, obviously, then we need to, because the calcium score is kind of taken that over, because we can actually see the heart arteries with the plaque buildup. But that doesn't mean that you can't have a carotid scan if you want to know the plaque buildup. You can do both.
Okay, sounds good. Well, thank you again so much for your time this evening, and we really appreciate it. And the information that you shared with us this evening is simply invaluable. And Zavanya is going to come in and do our closing.
Okay, yes, thank you so much, Dr. Shaw, for such an informative presentation tonight. I myself have learned a lot as well. Now I just have some very brief closing announcements to share. So Dr. Shaw has provided some information through her blog. I did put that in the chat. I will also be emailing her blog website tomorrow. So you will be getting that tomorrow. Also, I have also put in the chat our brief survey for this evening. So if you will, please take just a few moments of your time to complete that survey. It is very, very helpful for us here in the Social Responsibility Department to help to continue to bring informative sessions like this. So your participation tonight would be greatly appreciated. I will also be emailing that tomorrow as well. Next month, we will be right back here again on March 29th at 6 p.m. to discuss colorectal cancer in conjunction with Colorectal Cancer Awareness Month. So Dr. Ron Landman will be our guest speaker next month. And lastly, if you want to take a screenshot, please just take note of our future sessions that we have coming up in April and May. More details about that, about these sessions will be forthcoming. And we are also in the process of confirming more sessions throughout the summer and the fall. So please stay tuned for that. So that ends tonight's session. Thank you all so much for joining us tonight, and we will see you next month.